Now, amid rising humanitarian needs in Ethiopia's Amhara region, Lalibela, a town famous for its 12th century rock-hewn churches, has regained access to safe water thanks to the largest solar-powered water project by the International Committee of the Red Cross in Africa. The new system will provide reliable water to an estimated 77,000 residents, addressing shortages caused by years of conflict and unreliable power supply. Joining us to discuss the impact of this project and the broader humanitarian situation in Amhara is Stephen Anderson, Communications Coordinator for the ICRC in Ethiopia. Stephen, thanks for making time to talk to us. How are you?
I'm very good. Thank you very much for having me.
Can you tell us how this new solar-powered water system in Lalibela works and what it will mean for these 77,000 residents who will now have reliable access to water?
Yes, it has been a very difficult situation for these people basically since 3 years. There was really a problem of access. Water supply was very difficult actually since the conflict in northern Ethiopia. So for the people, it was almost impossible to have proper, reliable access to water. So with the authorities, over 3 years ago, it was decided that the ICRC would help with installing a water system that is basically functioning on solar energy, because the power supply was the main problem actually for having this function. So we worked this out with the local regional authorities. We had good support, notably from the German government, who financed this project at 50%. And we're very happy that after intense works and a difficult period, we were able to inaugurate this new system this week in Lalibela itself. So this is going to be a big step for the people. So indeed, it's the whole population of Lalibela town, 77,000 people who are now benefiting from this new system.
Operating or implementing a project like this, of this scale, one can imagine on top of the scale, this being in a conflict-affected area will pose some challenges. So how difficult, or what were the difficulties that the ICRC faced in its getting it up and running, and how were these worked around?
Yeah, I mean, one of the main difficulties was really the security situation. So indeed, as you mentioned, it has been since August 2023 that another armed conflict has started and is still ongoing. For the people, it was basically going from one to the other. And the security environment has been difficult to bring all the material that was required to do the installations. We had to purchase also material from abroad. So these were conditions that made it difficult to really manage that project in a short period of time. We installed 3 places where there are the solar panels, and basically it works, it pumps, it provides energy to pump the water, and then the water is brought up the mountain with 3 booster stations. Then it goes all the way up to the mountain where Lalibela is actually has been built. And then with gravity, it goes down and provides the water to the different houses and places where the people need access to water. So this is quite a complex system. It's very interesting because it's also environmentally friendly, and it's for that reason a sustainable project that should now really provide reliable water for the people for hopefully the long term. So it's making a huge difference for them. And let's hope that the security conditions remain okay so that there will be no further complication with this power supply and water supply.
As you mentioned earlier, the ICRC had partnered with the local authorities and communities on this project. So how have they pledged then to maintain this water system, and how will the project remain sustainable?
Yes, it's important that the sustainability is maintained. So we have trained water utility staff. Basically, 15 of them have been trained. Now, of course, with the inauguration, it's a handover to the authorities, so they are now fully in charge of managing the system. But it doesn't mean that we are leaving and going away all of a sudden. No, we will still be there, and we will be continuing to monitor the project, uh, especially for the next 6 months, and providing technical support when necessary.
Beyond water supply, what are the other urgent needs that the ICRC is addressing in Amhara, especially for people affected by conflict there?
Yes, the current situation is really difficult for the people. So essentially, the basic services are under strain, and one of them that I can highlight is really the access to healthcare. So access to healthcare is really becoming, has already been for a while, but is becoming even more problematic now. It's difficult for the ambulances to go to different places, rural areas, hard hit, hard to reach areas. They have a hard time to reach there. There are many blockages. So people cannot really evacuate when there are needs, when people are sick, people are injured, pregnant women, to go to the hospitals to get the proper treatment. It is a big challenge in many situations. So because of that, civilians are actually walking long distances in difficult conditions. And this is one of the main concerns that we have because, of course, access to healthcare means also saving lives. So lives are at risk in this current situation, and it's important that we continue monitoring and continue helping as well the different health facilities that exist in the region. This is also what we've been doing, complementing the authorities, providing a lot of medicines, medical supplies. Actually, we've been doing that for 33 health facilities in the Amhara region since the beginning of the year.
So, in terms of the next step for the ICRC in supporting these communities in the Amhara region, what can the international community do to assist?
Well, it's important that we continue to get support. I mentioned Germany, who provided support for the Lalibela water supply project. I think it's important that we continue getting support from donors for our response in Amhara, actually in various regions of Ethiopia, but currently Amhara is probably the conflict with the most acute needs. So indeed, I mentioned the water project. We are also helping in rural areas, repairing hand pumps for people's access to water in those regions. This is also in many places an issue. So since the beginning of the year, we have in total provided fresh water, safe water for 230,000 people. There's the health situation, which I mentioned, which is very important. But we also have situations with people detained, and it's a very important role as well from the International Committee of the Red Cross to be able to access people that have been captured, detained, wherever they are, whoever they are, to be able to monitor the conditions in which they are held and the treatment that they receive. And of course, to help them also establish contacts with their family members if this is an issue. So this is also a big effort that we're continuing to do and monitoring basically the humanitarian situation, the respect for international humanitarian law.
Stephen, thank you so much. We'll leave it there for today. We appreciate your time again.
Thanks a lot. Have a good day.
Thank you, you too. Stephen Anderson, Communications Coordinator for the ICRC in Ethiopia, speaking to us about the newly inaugurated solar-powered water project in Lalibela and the broader humanitarian challenges in the Amhara region. Let's get our news headlines now. Here's Onele Nzinzi at 6:31 Central African Time.
SABC News.